Welcome to another episode of Talking with Docs. I'm Dr. Brad Winning.
And I'm Dr. Paul Zalzal.
Okay.
Should I?
Should I? Yes, we have a little series that we're going to be working on called Should I Eat It? Should I Take It? Should I Do It?
This is it. New series, Talking with Docs. We're always evolving, right?
Evolving.
And now the question is, and if you have any of these should I questions, just put them in the comments and maybe we'll make a video about this.
Sure.
Should I take it? Should I do it? Or should I eat it?
Yeah.
What are we going to do first today?
Today is a should I do it, and it's should I not do it, or should I stop doing it? Should I stop taking my blood thinner before surgery, before significant surgery?
Good question. A lot of people are on blood thinners for various reasons.
Yep.
You have atrial fibrillation, you might be on a blood thinner.
Sure.
If you've had a blood clot before, you might be on a blood thinner. If you have a certain type of stroke, you might be on a blood thinner.
Yeah, or if you have significant risk factors, you might be even on something like aspirin over the counter.
Yeah, so there's lots of different types of blood thinners. There's antiplatelet agents like aspirin.
Yep.
There's new novel oral anticoagulants. There's even injectable ones that you give yourself. Okay, so should I stop my blood thinner before surgery?
So obviously it's like a probably. So the group probably that can't stop them is someone that has essentially a life-threatening disease that if they stop taking it, they would die from that disease. So this is thankfully very, 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 very uncommon.
And so what we do sometimes in those cases is we do what we call bridging. If you're on a certain type of blood thinner that stays in your body for a while, even after you stop it, then we stop it a while before surgery, but bridge that time with probably an injectable blood thinner that has a very short time of effect, so that if you stop it the day before surgery, you'll be okay for your surgery.
Right, so we have a very narrow window to operate in, but you also have a narrow window of you not being protected.
So generally, you're probably going to have to stop your blood thinner, but don't go and do that without checking with your anesthetist and your physician and your surgeon before.
Right, and if you're close to surgery and no one has addressed this with you, ask them, speak up, advocate for yourself, say, listen, I'm on this and I'm pretty sure I have to stop it, but no one's told me when to stop it.
Yeah, that's a good point. Make sure you disclose that medication to your healthcare provider.
So why does it matter, Paul? Like, why can't people be on blood thinners for surgery? Like advanced medicine, really, you can't operate with a little bit of bleeding?
Great question. I'd say one of the biggest concerns is with the anesthetist.
Sure.
Because many surgeries are done with a regional anesthetic. Check out our video on spinals and epidurals.
Yep.
And the concern is when you're putting a needle around the spine, you don't want any extra bleeding.
No.
So that's one. And of course,
operative bleeding.
Yeah, the surgical bleeding. When we make a big incision or a small incision or any incision, there's going to be bleeding. If you're on a blood thinner, then the bleeding may become excessive.
Right, and causing two problems. One, it's hard to operate when you can't see because there's too much blood. And two, if your blood count drops low enough, you would need a transfusion. It would increase your risk of a heart attack or a stroke or other metabolic compromise. So those are probably the two big ones.
So the bottom line is, should I stop my blood thinner before surgery? Probably going to have to, or at least change it to a different type of blood thinner that has a shorter time of effect.
Yeah, and then we would just restart it after surgery, and the timing of that, again, depends on your operation and the type of blood thinner and the reason that you're taking it.
Yeah, so absolutely don't go on your own and say, I just saw this video, I'm going to stop my blood thinner.
Don't go rogue.
Surgery. Yeah, make sure you just discuss it with your anesthetist or your surgeon at your preoperative visit.
There you go, good summary. So the should I is probably, yes, you probably should stop it, but under the guidance of a medical professional.
Should I? Let us know if you like this new feature. Should I? Should I take it? Should I stop it? Should I do it? Should I eat it? Should I?
Stop talking.
There's lots of should I's.
If you like this video, please like it, subscribe to our channel, and check out our other formats, TikTok, Instagram, Facebook Reels. We're spreading out.
And remember, you are in charge of your own health. Should I watch this video?
You should, 100%. We'll see you next time.